Hello everyone, welcome to my YouTube channel, and in this video we're discussing a question in medicine and medical nursing entitled Dysentry. Your presenter here, IDE Henry. Without wasting much of your time, let's quickly go straight into answering the questions. I have a question with me here, and the question reads as follows. Mrs. Kitika, a 32-year-old marketeer, is admitted to your ward with a provisional diagnosis of bacillary dysentery. Yes. Question A. Name 5 causative organisms of bacillary dysentery. State 5 signs and symptoms that Mrs. Kitika will present with on admission. Then question C. Discuss the management of Mrs. Kitika during hospitalization. And lastly, explain 5 points you would include in your information, education, and communication to marketeers on the control and incidence of dysentery. Let's start with answering the question. Question A. Define dysentery. So dysentery can be defined as an acute inflammatory diarrheal condition of the digestive system caused by microbial agent affecting the colon and is characterized by abdominal pains, frequent loose stools, which can be stained bloody and mucoid. So that's how you define dysentery. The next question is list 5 organisms, causative organisms of bacillary dysentery. We've got the following: Shigella sonnei, Dysentry, Boydii, Shigella shiga, and Flexneri. We go to the next question. State 5 signs and symptoms that Mrs. Kitika will present with on admission. Sign and symptom number 1, bloody diarrhea. So Shigella bacteria invade the damaged lining of the intestines, leading to inflammation. Now this results in loosey stools, which are often containing blood. Next is abdominal pains. This results from the inflammation of the intestinal lining as well as muscle contractions, causing discomfort and pain in the abdomen. Then, the other sign and symptom is that of fever. This results from the body's response to infection, causing a rise in temperature to fight off invading bacteria. Then we have got tenesmus. This is a sensation of needing to have a bowel movement even when the rectum is empty, and this is caused by the inflammation of the rectum and lower colon. Lastly, we've got the last sign, which is dehydration. So the diarrhea, particularly when it's severe, can lead to dehydration. This occurs because the body loses significant amounts of water and electrolytes through diarrhea and may not be able to keep up with fluid loss. Having said that, we go to the next question. Discuss the management of Mrs. Kitika during hospitalization. So take note, dysentery is a medical emergency, therefore we are going to resuscitate. And straight into that, medical resuscitation, primary assessment and resuscitation. So firstly, you have to let the markers know that you are resuscitating. Make them understand that this is an emergency. How? By writing primary assessment and resuscitation. So you write the following: airway, breathing, circulation, and drugs. So under airway, we write the following statements. Airway: I will assess the patient's airway to ensure it's clear of any obstruction such as vomitus or mucus that could interfere with breathing, which in this case there isn't. The airway is very much patent. Breathing: I will assess the patient's breathing pattern to determine if it is adequate and if there are signs of respiratory distress, of which in this case there isn't. Then we go to the next one, which is circulation. Now this is the part where we do most of the nursing care. Subheadings under circulation: fluid and electrolyte replacement. I will establish an IV line using a sterile cannula for fluid administration. I will administer a fluid. You are going to administer Ringer's lactate. Yes, at least first 500 ml to run in the first 30 minutes, another 500 ml to run in the other or next 30 minutes, making it an hour. When you do that, then you've resuscitated. Then we go to subheading number 2, blood transfusion. So this patient is losing both fluids, but the fluid is bloody, meaning that the patient is going into a state of hemolytic anemia. So blood transfusion. So I will collect the patient's venous blood for HB count to determine levels of HB as well as grouping and cross-matching. Then if the patient's HB is less than 9, I will commence blood transfusion to replace the lost blood. That being done, we go to drugs. So this patient is also losing literally all the nutrients, carbohydrates involved as well. So meaning the patient is also going to be in a state of hypoglycemia. So I will assess the patient's sugar level to note if the patient is hypoglycemic, and then if the blood sugar is less than 3.0 millimoles per deciliter, I will administer 20 ml of 50% dextrose to correct hypoglycemia. Then after resuscitation, you can continue with the following, which is the subsequent care. So medical management. Investigations. We are always going to start with history, and under history taking or writing, history will review having been exposed through public gatherings or living in an area endemic to dysentery. Then history will also review recent episodes of passing loose stool which are bloody. And then next after that is physical examination. So physical examination, you can explain the following things. On inspection, the patient presents with sunken eyes, pallor and indicative of anemia and dehydration. Then on palpation, the patient presents with skin pinch which turns back very slowly. Then on auscultation, the patient presents with irregular bowel sounds. Then lastly, we go to lab investigation. So under lab investigations, a stool sample for microscopic culture and sensitivity will review causative organism, which can be either since they have already told us that it's bacillary dysentery, this is going to review either of the 5 species. Then stool for lab investigations is also going to review presence of blood, confirming the diagnosis. And then blood for FBC, this is also going to review HB levels in blood, and it's also going to tell us high elevated cells, which are the white blood cells. This will be indicative of infection, and there's also going to be reduced red blood cell count, indicative of hemolytic anemia. Then we have radiological investigations. To quicken that up, barium meal will review inflamed colon. Yes, colonoscopy is also going to review active bleeding and ulceration in the colon. That being said, ladies and gentlemen, we go straight to the treatment. In the treatment of bacillary dysentery, the drug of choice is nalidixic acid, and I'll keep mentioning even in this video, when medical management has been specified to say medical management, do not start explaining nursing implications, contraindications and the like. Mention the drug, the dose, the route and frequency. So antibiotics as a class, so you write your heading like so. Then you write your drug as number 1. Nalidixic acid is the drug of choice, which is given orally in bacillary dysentery for 14 days. Yes, it is given orally 4 times daily for 14 days. Or you can give ciprofloxacin, which is an oral drug, 500 milligrams orally. Yes, same period. Then the second class of drugs is that of analgesia, paracetamol 1000 milligrams to relieve pain and relieve fever. Then intravenous Ringer's lactate to replace lost fluids. We have already given blood. So that being done, we now dive into the nursing management. So we're writing following aprofenamide. Yes, aprofenamide. So our aims, we've already resuscitated, and if the question just states management, you need to include that in your resuscitation. So if the question is going to state describe the nursing management without the medical management, then don't forget to include primary resuscitation, assessment and resuscitation. So we start. What are our aims? Aims are that we're going to identify and isolate as well as treat the causative organism, then relieve symptoms and prevent complications. Environment. I'm always going to keep this straight and simple. You mentioned the ward. I will nurse the patient in a medical ward. I will nurse the patient in acute bay. I will nurse the patient in isolation but near the nurse's bay for close monitoring, because dysentery is very infectious. Equipment around patient's bed, I'm going to keep a bedpan, drip stand, oxygen cylinder and all that. Then cleanliness and lighting, I will nurse the patient in a clean and well lit environment, and I will nurse the patient in a well ventilated environment. Then positioning, I will nurse the patient in position of preferred comfort because the patient is very much irritable and restless. Secondly, I will allow 2-hourly turning to prevent pressure sore formation. I will allow and encourage ambulation to promote circulation as well as prevent pressure sores. Then I will nurse the patient on a floor bed or a bed that has got a low profile, so that we prevent physical injuries such as falls. That being the case, we talk about rest. Under rest, you can explain the following things. I will provide a quiet and calming environment to facilitate rest. I will offer pain relief and assistance with any discomfort that may disrupt rest. I will establish a routine for rest periods and minimize disturbances. I will educate the patient on the importance of rest and stress management. That is all on rest. Then we go to observations. Observations, I will regularly monitor the patient's vital signs such as temperature, pulse, and respiration. Yes, I will assess the frequency and character of the patient's stools, checking for presence of blood and mucus. I will keep track of the patient's fluid intake and output to assess for signs of dehydration or fluid overload. I will observe for any signs of complications such as high fever or severe abdominal pain. Lastly, I will document and communicate observations to the healthcare team for timely intervention. That is all on observation. The next heading is that of psychological care. And here we explain the following things. I will explain the condition to the patient to allay anxiety. I will explain reasons for isolation. Number 3, I will explain symptoms to the patient and the current treatment that the patient is receiving. Number 4, I will explain the tubings and equipment around the patient's bed to allay anxiety. Number 5, I will allow the patient to express concerns and ask questions to promote cooperation and allay anxiety. Lastly, I will explain all procedures being done to the patient to promote cooperation and allay anxiety. Then we go to our hygiene. Under this heading, you can explain, I will emphasize the importance of frequent hand hygiene for the patient and family members and healthcare staff. I will assist the patient in maintaining personal hygiene, including oral care and bathing to prevent skin breakdown as well as infection. I will ensure that the patient's immediate environment is clean and free from contamination. I will ensure the safety and safe disposal of contaminated materials such as used tissues, soiled linen, and the like to prevent the spread of the bacteria. Then, elimination. Monitoring stool output. So I will closely monitor the patient's stool output, including the frequency, consistency, color, and the presence of blood and mucus. Number 2, I will assist with toilet needs. So I will assist the patients in a timely manner when they need to use the toilet, and as frequent diarrhea can be leading to urgency. Thirdly, I will provide and assist with the use of a bedpan and a commode chair to maintain dignity and cleanliness. Fourthly, I will educate the patient on the importance of proper hygiene after each bowel, emphasizing thorough hand washing to prevent the spread of infection. I will ensure safety and hygienic disposal of soiled linen such as bedpans or commode buckets, using appropriate infection control measures to prevent contamination of the environment and spread of the bacteria. Next, which is nutrition. I will provide adequate feeds consisting of a well-balanced diet to promote good nutritional status. I will give the patient feeds rich in proteins to replace worn-out tissue and promote recovery. I will give the patient feeds rich in carbohydrates for energy, such as rice, potatoes, and juices. I will give the patient feeds rich in vitamins to maintain normal body metabolic processes. Lastly, I will provide a high-fiber diet to promote subsequent constipation. That being said, the next heading under our nursing management is that of exercises. Here you can explain the following things. I will encourage the patient to rest and avoid strenuous physical activities during acute phase of infection to conserve energy. I will provide information on the benefits of gentle non-strenuous activities such as walking or stretching to prevent muscle weakness and maintain mobility. I will assess the patient's level of fatigue and adjust activity recommendations accordingly. And I will monitor vital signs and the patient's response to any physical activities, ensuring that they do not exacerbate symptoms. Lastly, I will collaborate with the physical therapy or occupational therapy as needed for patients with severe complications or prolonged bed rest. That being said, ladies and gentlemen, our next heading is that of medication. Here you can explain, I will administer prescribed antibiotics such as ciprofloxacin or azithromycin as ordered by the healthcare provider to target Shigella infection. Next, I will educate the patient on the importance of completing the full course of antibiotics even if symptoms improve to prevent drug resistance. I will administer antidiarrheal medications cautiously if prescribed, as they may not be recommended for all cases and can sometimes worsen the infection. Fourthly, I will monitor for any adverse reactions of medication such as allergic reactions or gastrointestinal upset. Lastly, I will ensure proper documentation of medication administration, including dosage and timing. That being said, We can now talk about our IEC in our nursing management. I will provide the patient with information about bacillary dysentery, its causes and mode of transmission. That being said, I will offer guidance and proper hand hygiene techniques to prevent the spread of infections to others. I will educate the patient on signs of dehydration and when to seek immediate medical intervention. Also, I will discuss the importance of completing the prescribed antibiotic course and potential side effects. Having talked about that, you can conclude saying, I will promote open communication and encourage the patient to ask questions or express concerns about their condition and treatment plan. That being said, ladies and gentlemen, we have answered the question. Then the last question was 5 points in IEC to the marketeers on the prevention and incidence of the disease. Number 1, food safety and hygiene practices. I will emphasize the importance of strict food safety and hygiene practices at every stage of food handling distribution, from procurement to sale. That's number 1. To the marketeers. Secondly, I will educate the marketeers about proper hand washing techniques, the use of gloves and regular cleaning, sanitization of food preparation and serving areas. To the marketeers. Then the second point is that of safe water resources or safe water sources. I will stress the necessity of using clean and safe water sources for food preparation, including washing fruits and vegetables. To the marketeers. Also, I will encourage marketeers to be vigilant about the quality of water used, especially in areas where the water contamination is a concern. Then, the third point, proper food storage and temperature control. I will explain the significance of proper food storage to prevent the growth of bacteria. Marketeers should be aware of the temperature requirements for different food items, including refrigeration where necessary. Also, I will advise them to avoid storing ready-to-eat and raw foods together to prevent cross-contamination. Number 4, handling and cooking practices. I will educate marketeers about the importance of thorough cooking, especially for meat, poultry, and seafood, to kill harmful bacteria. Also, I will encourage safe handling of food, such as using separate cutting boards for different food items and avoiding the use of utensils that have touched raw meat for other tasks. Having talked about that, the last point is that of early detection and reporting. I will stress the need for marketeers to be vigilant about the quality and freshness of their products they sell, and I will encourage them to inspect the food items for any signs of spoilage and contamination. Also, remember to stress the fact that they should provide information on common symptoms of foodborne illnesses like dysentery, and emphasize the importance of reporting any suspected cases promptly to local healthcare authorities. That being said, ladies and gentlemen, we can do a quick summary. So in our video, we have looked at the causative organisms of bacillary dysentery. We have stated 5 signs and symptoms. We have discussed the management. We have explained 5 points which we would include in our IEC to marketeers to control the incidence of dysentery. That being said, ladies and gentlemen, thank you very much for tuning in to my YouTube channel and watching my video. See you in my next video. Until then, bye bye.